പ്രിയ ഡോക്ടർ, ശ്രീലേഖ ഡോക്ടറെ ഒന്ന് സ്ക്രീൻ ഷെയർ ചെയ്ത് നോക്കിയോ വേണമെങ്കിലും ജസ്റ്റ് വോയിസ്.
നോക്കട്ടെ,
അതൊന്ന് നോക്കോ ജസ്റ്റ്.
ശരിയായില്ലേ?
ആയിട്ടുണ്ട് ഡോക്ടർ, ആയിട്ടുണ്ട്.
കേൾക്കുന്നത് കാണാം. സ്ക്രീൻ വിസിബിൾ ആണ് കേട്ടോ.
ഓക്കെ.
ശ്രീലേഖ ഡോക്ടർ ഫുൾ സ്ക്രീൻ ആക്കാൻ പറ്റില്ലേ? അതിങ്ങനെ വെക്കണമെന്നുണ്ടോ?
എങ്ങനെ
ഫുൾ സ്ക്രീൻ ആക്കാൻ പറ്റുമോ? സ്ക്രീന്
സ്ക്രീൻ
ഓക്കെ ഫൈൻ. ഗുഡ് മോർണിംഗ് ശ്രീപ്രിയ ഡോക്ടർ ആൻഡ് ആശ ഡോക്ടർ.
ഗുഡ് മോർണിംഗ്.
നമ്മൾ പിന്നെ അത് ഇംഗ്ലീഷ് ആക്കിട്ടോ, അതുകൊണ്ട് കുറച്ച് ഹിന്ദിക്കാരൊക്കെ കേറിയിട്ടുണ്ട്.
രജിസ്റ്റർ ചെയ്തവർ എത്രയുണ്ട് ദീപു?
അത് 100 പേരുണ്ട്. പിന്നെ ഞാൻ വിചാരിച്ചു നമ്മൾ കൂടുതൽ യൂട്യൂബ് നോക്കാന്ന് വിചാരിച്ചേ. മറ്റേത് ഇങ്ങനെ ലിങ്ക് ഇങ്ങനെ ഒരുപാട് രജിസ്റ്റർ ചെയ്തവർക്ക് എപ്പോഴെങ്കിലും കയറാം. പക്ഷെ എനിക്ക് തോന്നുന്നില്ല, 11 മണിയല്ലേ, എന്തൊരു പ്രശ്നമുണ്ട്.
അതെ, അല്ല ഇപ്പൊ 15 വരെ ഉള്ളൂ.
യൂട്യൂബിൽ കയറി ജോയിൻ ചെയ്തോളൂ. യൂട്യൂബ് നമ്മൾ ലൈവ് ആണ് അവിടെ ടെലികാസ്റ്റ് ചെയ്തോണ്ടിരിക്കുകയാണ് കേട്ടോ. നമുക്ക് സ്റ്റാർട്ട് ചെയ്യാം. തോന്നുന്നു ശ്രീലേഖ ഡോക്ടർ ഒന്ന് സ്ക്രീൻ ഷെയർ ഒന്ന് നിർത്താവോ?
ഒരു മിനിറ്റ്
ഒന്ന് നോക്കാന്ന് വെച്ചിട്ട്. ഓക്കെ, ഡോക്ടർ തുടങ്ങി. ഒരു സെക്കൻഡ്, റെക്കോർഡിങ്. ശ്രീപ്രിയ ഡോക്ടർ തുടങ്ങി.
Good morning everyone. We welcome you all to the seminar by Dr. Sreelekha, conducted by IHMA Ernakulam chapter. Now a few words about IHMA. IHMA is a pioneer organization of elite qualified homeopaths of India with its presence along the length and breadth of the country. IHMA has been relentless in its efforts to upbring the quality of Indian homeopathy and its practitioners. The main objectives of IHMA are to improve the quality of homeopathic medical practice and medical education, to maintain the honor and dignity, and to uphold the interest of the profession of homeopathic practice, and to promote cooperation amongst the members thereof, to stand for and facilitate the integrated medical research in homeopathy, and to promote the advanced homeopathic system of medicine and allied sciences and improve public health thereby. Homeopathic Medical Panorama is the official journal of homeopathy. Its tri-monthly medical journal covers latest medical articles and news pertaining to homeopathy and medical sciences in general. It also covers the policy matters and other associated events and happenings in Homeopathic Research Center at IHRC. IHMA School of Homeopathy proposes a comprehensive package imparting meticulous personal training for cultivating the necessary skills which are essential for effective homeopathic practice. IHMA has spread its wings all over India and abroad. And as you all know, through this webinar series during this lockdown period, homeopathy has flourished a lot, and it has helped to bring all of us together under one roof, IHMA. I welcome you all to this wonderful seminar, and I welcome Dr. Asha to give a brief introduction about our faculty. And I welcome you all, and I especially welcome Dr. Sreelekha to this seminar. Welcome, ma'am.
Thank you.
Thank you, Sreelekha, Doctor. Good morning. I am Dr. Asha. IHMA Ernakulam District Committee Weekend Webinar Series 2021. In this occasion, it's my privilege to introduce our eminent faculty, Dr. Sreelekha Vinod, who has been practicing in Dubai since 2003. She is currently working in Medex Vegan Clinic in Naira, Dubai. She is graduated from Adarashram Homeo Medical College, Kottayam, winning first rank in BHMS from Mahatma Gandhi University in 1997. She was honored by the UAE government in 2016 by receiving the Distinguished Family Award from His Highness Sheikh Hamdan bin Rashid Al Maktoum for her distinguished educational, cultural, environmental, and social activities. She was the secretary to homeopathy in Aish International Conference and the exhibition held in Dubai 2017. She is also the life member of IHMA and one of the founder members of IHMA UAE chapter as well. She was the president of the UAE chapter in 2019 and 2020. Alopecia is a common problem in all age groups, both male and female. Homeopathy helps to manage alopecia areata very well. Today, Dr. Sreelekha Vinod going to deliver the topic alopecia areata, causes, victims, and homeopathic management. I heartily welcome you, ma'am. Thank you.
Thank you, Doctor. Good morning, all doctors. It is my pleasure to be a part of it with you today morning. Before starting, I really appreciate IHMA for conducting such a long webinar series, especially in our COVID pandemic situation. As we all know that it is very difficult to do a closed sessions or closed classroom sessions or conferences. Today, my session is basically on alopecia areata and its homeopathic management. Before doing our clinical manifestation, clinical management or homeopathic management, I will give a brief introduction about the theoretical part. Deepu, can I share now? Dr. Deepu?
Yes, ma'am. Yes, yes. It's visible now.
Yeah. But I cannot, 1 minute.
One more second.
Yeah.
Hello? ശരിയാവുന്നില്ലേ?
Yeah, sure. Okay. Am I audible? Okay, na?
Yeah. Okay.
Our hair is a statement of style, an affirmation of beauty, and an expression of self-love. Hair is the most wonderful and distinct feature of one's personality. It is the second fastest growing tissue in the body after bone marrow. Our hair is constantly growing and has a lifespan of around 5 years. 90% of our hair is constantly growing at any given time, while the other 10% is taking a break. It is normal to lose 50 to 100 hairs every day, but excessive hair loss causes psychological and emotional disturbance to the affected person. This is a condition why we are telling the hair loss become a main concern to a normal people. These type of cases, the hair loss is a common feature, especially when we are in our working condition. We are getting many cases depending upon people are complaining about hair fall. But on hair fall itself is a common statement, but that itself we can also classify it in different terms. Scientifically, the hair loss is called as alopecia. Okay, it can affect our scalp, our entire body. Alopecia or hair loss is classified as scarring or non-scarring alopecia. Scarring alopecia is mainly, otherwise we call it as cicatricial hair alopecia. Why means once the hair loss is happened, it is irreversible. The main reasons are growth disorder and inherited diseases, damage from natural causes, especially we know burns or any mechanical trauma, infections, any severe infections, especially viral, microbial or any parasitical infection can also lead to a permanent loss of hair, and neoplasia and various other skin diseases of unknown etiology. Another category is non-scarring alopecia. Here we have a good scope on our medicines. It is a loss of hair without any scarring being present. Along the category, there is a physiological alopecia. That means a daily a loss of 50 to 150 hairs, especially in seasonal or any environment influences. And diffuse alopecia. Diffuse alopecia, otherwise we call it as telogen effluvium. This is the most common situation. Normally in the clinic, people are coming and complaining a loss of hair, a diffuse loss of hair that will end in the reduction in the mass of the total mass of the hair. That is mostly we'll seen in, especially after a severe infections or any hemorrhages, any surgical shock, or continued mental or emotional distress that can lead to a total hair, not a total hair loss, in the a gradual hair loss. In that situation, it is our duty to find out what is, we know the reason why the people will come and say, after a particular reason only my hair is started to fall. In that situation, our treatment will be very easy, that we know the etiology behind that. We can go ahead with that point and that treatment can start. And another one is the androgenic alopecia, that is a common male or female pattern baldness. That we know that, and at a particular age, even men or women complaining that they have a hair falling, that will be a gradual, that will also a gradual process. And normally it is starting from the vertex or in the forehead. Slowly, the years by years, it will improve. We can say it is an autosomal dominant nature, that hair fall has a nature, and in that category we don't claim any prognosis when we have started our treatment. And another one is the alopecia areata. That is my subject, what I am going to say. Alopecia areata is a sudden loss of hair fall that is mostly in a patchy hair loss. That is, we have to distinguish that from alopecia areata and androgenic alopecia or a diffuse alopecia when a clinical situation. And another one is the traction alopecia. Traction alopecia, normally the people who are working in doing more hairstyles, especially the continuous pulling of the hair, leads to the decay or damage or erythema of the hair follicle, that leads to the weakness of the hair follicle, and then damage can happen. That can be reversible if the people will understand the situation and they stop their hairstyle. Then most probably the hair will grow naturally. Next one is trichotillomania. Trichotillomania is seen both in children and adult, but normally it is seen in people with the psychological or emotional disturbances. In that situation, psychological or emotional support is enough for other than a medical treatment. Most probably children, we see the children, they keep on pulling their some hair, part of hair, and especially when they are under stress, when they are doing their studies, or even in the thinking also, some people will keep on pull their area, continuous pulling of a particular area of the scalp, leading to the hair fall. And why I am describing all this category means, while a case of hair fall come, we have to distinguish in which criteria we have to start our treatment. Next. The structure of the hair, before we should have an idea. Hair is made up of a tough protein called keratin. Keratin follicle anchors each hair into skin. The hair follicle can be divided into 3 regions. That means mainly the lower segment is in the picture you can see the lower segment is the bulb and the suprabulb. The middle segment is called isthmus and the upper segment is the infundibulum. The lower segment extending from the base of our hair follicle to the insertion of the erector pili muscle. It is, we can see in the picture here till the area. And the middle segment is a short section of the hair that extend from the insertion of the erector pili muscle to the entrance of the sebaceous gland duct. And the upper segment extend from the entrance of the sebaceous glands duct to the follicular orifice. The hair bulb forms the base of the hair follicle, and the blood vessels nourishes the cells in the hair bulb and deliver hormones that modify hair growth and structure at different times of life. Okay, regarding the stage of hair growth, the growth cycle of hair has 3 main stages: and anagen phase, catagen phase, and telogen phase. Anagen phase is the growth phase. That means in this phase of the hair grow almost approximately 1 centimeter per month, and the span at which the hair remains in this stage growth is determined by genetic factors. The length of the hair stays in anagen phase, the longer it grows. That means we know that some people have long hair, some have very short hair. Irrespective of how many care they do or not, the hair will grow at a particular length. After that, it will fall. Why it is means that there is some genetic factor is there in the anagen phase of each pupil. Okay, if they have a long anaphase cycle, they have a long hair. Next one is the catagen phase or the transitional phase. During this time, which lasts about 2 weeks, the hair follicles shrink due to the disintegration and the papilla detach and rust, cutting the hair strand off from its nourishing blood supply. The last one is the telogen phase, or we call it as a shedding phase. During the telogen or resting phase, the follicle remains dormant for 1 to 4 months. 10 to 15% of the hair on one's head are in this phase of growth at any given time. That means in 1 hour scalp, all the hair are not in one phase. Some are in anagen phase, some are in catagen, and some are in the telogen phase. That cycle is always rotating. Once the cycle is complete, it restarts and a new strand of hair begins to form. The growth rate of hair varies from individual to individual depending on the sex, age, genetic predisposition, and countless environmental factors. Next is the alopecia areata. This is the most common condition seen in children as well as adults. The patient or their relative suddenly notice a sudden loss of hair in single or multiple areas on scalp or any other hairy areas of body without any apparent reason. This without any apparent reason is very important. That is, we call it as alopecia areata. Most of the cases are asymptomatic. Recent study reveals that more than 5 million people in the United States have alopecia areata. Actually, it is an autosomal disease resulting from the disturbances in the immune level of a person. Otherwise, we call it as there is a breach in the immune privilege of hair follicle in which body attack itself on the anagen hair follicles and suppress or stops the hair growth. In the picture, you can see that in the active lesion, there is an infiltration of CD8 T lymphocytes and CD4 T lymphocytes. Okay, and what we called as there is a infiltration of these T lymphocytes around the surrounding the hair bulbar area. Hair follicle in the normal states are thought to be kept secure from the immune system, which is called as immune privilege. A breach in this immune privilege state is considered as the cause of alopecia areata. In alopecia areata, it is the defect in our immune system. The primary eliciting factor and the resulting cascade of event in the pathogenesis of alopecia areata remains still unclear. Genetic, hormonal, growth factors or inflammatory molecules may play a role, but till now we couldn't identify what is the exact reason behind the infiltration of the T lymphocytes. Collapse of the immune privilege in the hair follicle is regarded as one of the primary causes. T cells swarm around the root and kill the follicles. This causes the hair to fall out and part of the head to bald. T cell lymphocyte cluster around the affected particle, causing inflammation and subsequent hair loss. You can see in the picture. Type of alopecia. Clinically, it is we have to differentiate what type of alopecia we are getting. And first one is the alopecia areata monolocularis. The name itself, we can say the hair loss is only in single area in the scalp, where only a single area, that is otherwise we call as spot baldness, in which falling of hair is in a single spot. If it is in the multiple areas of the scalp, we can say alopecia areata multilocularis. If it is seen in only in the beard area and especially in male, that can be a single or in multiple areas, we call it as alopecia areata barbae. And fourth one is alopecia areata totalis. Totalis means it is the complete loss of hair in the scalp itself. Okay, and alopecia areata universalis means it is the loss of hair in the scalp as well as in the hairy areas of especially eyebrows, even in the axilla, in any areas of the hairy area, the total loss will happen. That is called a universalis. And last one is called the ophiasis alopecia. This is a pattern. See, this is a patterned hair loss that especially we can see in the parieto-occipital area. This sometimes it can reach up to our earlobe. This is a type of pattern. This pattern will be clear in some cases. That is, we can say that it's alopecia, ophiasis alopecia. And depending upon the epidemiology by sex, alopecia areata in the male, it occurs both in male and female, but the loss of hair is likely to be more significant in men. They experience facial hair loss as well as their scalp, chest, and back hair. Compared to the male pattern baldness, that is a differentiating feature, which is male pattern baldness is very gradual thinning of hair all over, but but alopecia areata is very sudden loss of hair loss. Alopecia areata in female, it is occur in scalp as well as in eyebrows and eyelashes. Unlike female pattern hair loss, which is a gradual thinning of hair that covers the large area, alopecia areata may be confined to a small area. And alopecia areata in children. Children can also develop alopecia areata, but in children, in addition to the hair loss, you should notice some of other symptoms or signs are there, such as nail defect or pitting of the nail, especially we can see. Adults may also experience these additional symptoms too, but it is very common in children. According to the National Alopecia Areata Foundation, children younger than the age of 5 typically don't experience much of the emotional impact from the alopecia. After the age 5, however, hair loss can be traumatizing for young children as they start noticing how they are different from others. We already know that alopecia areata, we don't have any exact reason or exact pathology why it happened, but there are some exciting factors there for alopecia areata. Some of that history of acute or chronic disease, that especially high fever, tuberculosis, typhoid, malaria, nutritional deficiencies, vitamin D, minerals, especially vitamin D and vitamin E, and mineral including hemoglobin or zinc deficiencies, infections on scalp, hormonal changes, especially with PCOD, hypo or hyperthyroidism, and cosmetic treatments of the hair, uses of dyes, drugs, especially using antibiotics, antiviral, steroids, chemotherapy, medicine, etc. These are the exciting factors. And while taking, especially for homeopathic case taking, it is our duty to elicit what is the reason behind the sudden loss of hair. But normally the patients never come and complain. Only after this one I got this one, because for them it is a sudden loss, not in diffuse alopecia. In diffuse alopecia, the patient may complain, I am starting my hair loss after I get a fever, or after my surgery, or after my hair fall, or a bleeding, or after pregnancy, delivery, like that. But in alopecia areata, normally the patient will say, all of a sudden I noticed like that. That was their approach. So we have to find out what will be the exciting factor that leads to the alopecia areata. And in investigations, a doctor may able to diagnose alopecia simply by looking. That is easy, because while looking itself, we will find out what this alopecia areata. But we should do some blood tests in order to find out whether it may be because of some thyroid, some hormonal issues, or any other infections. Some of the common investigation we can do is a CBC, because we have to find out any anemia, ESR, C-reactive protein, to find out any infections, liver function, thyroid function test, because in hypo and hyperthyroidism, there is a chance of alopecia areata. And anti-nuclear antibody test to find out some autoimmune disorders, hormone FSH, LH, or total testosterone, to find out some. We have to distinguish whether it is alopecia, only a simple alopecia areata, or any androgenic alopecia, or a pattern baldness is there or not. And TPHA, Treponema pallidum hemagglutinatum test, is to find out, especially if there is any history of syphilis or anything. And mycological assessment to find out whether there is a history of fungal infection. And also a scalp biopsy, which is very rare, but with the direct immunofluorescence can also do, which will help to confirm the diagnosis of lichen planus or discoid lupus erythematosus or tinea capitis. But it is where normally we will never do. We can do CBC. Normally we can do CBC, yes, or C-reactive protein, or even thyroid also, to at least we'll get an idea. If the people with the ladies with the PCOD history or something, we can go ahead with our hormone test also. Okay, now I am planning to explain you one of my case. And before explaining the case, I want to say the situation how we are practicing in UAE. UAE is the country where homeopathy is legalized almost 19 years ago. In 2002, it is legalized. Almost 2003 onwards, I am practicing here. But here the thing is that we are legalized only some of the medicine, all polycrest, especially all polycrest and biochemic, and we are restricted to use that medicine only. It is very difficult for us to get high potency doses. Even in the high potency, 1000 10 potencies are we are not legally, we are not allowed to practice, because in our we are always doing in our online prescriptions. That is all based in our prescription. We will get only the medicine which is legalized in here, because of so we are mostly concentrated about polycrest or some our biochemic remedy for our practice and daily use. But we'll use high medicines in our personal interest. We can give the patient personally. Otherwise, legally we are advised to use only the medicine which is legalized in UAE. First case. In 2020 February, a 4-year-old boy was brought to me with a history of sudden hair loss from scalp, which was noticed 5 months before. His hair fall was getting worse for last 1 month. But the mother said that 5 months before itself, it started with the small areas of hair loss, but slowly it is getting worse. But on taking the history, he had a recurrent attack of upper respiratory tract infection since the age of 2 and was on antibiotic on each attack. The child has a history of recurrent sneezing, running nose, which end up in cough and wheezing respiration. So the pediatrician started prednisolone since 6 months and then tapered to 2.5 ml on alternate days since 1 month. Okay, but still the mother is telling that this hair loss happened after a viral fever, which was controlled with Tamiflu. That time he was on a daily dose of prednisolone 2.5. On the course of the prednisolone,
Hello, ma'am.
Sorry, yeah. Hello.
Ma'am, കുറച്ച് വെള്ളം കുടിക്കണം. Throat ഭയങ്കര dry ആയപ്പോൾ.
Yeah. Okay. Can I continue?
Oh, yes, ma'am.
Yeah. The hair loss happened after a viral fever, which was controlled with Tamiflu. That time he was on daily dose of prednisolone 2.5 ml also. The hair fall started in small patchy areas in different part of the head, and slowly it leads to complete loss of hair. That situation, what the pediatrician is also confused, which make him this situation, whether the Tamiflu is making his hair loss or the viral fever also lead that condition, or his general health condition is leading this hair fall. They are also in a confused situation, and mother is also working in a clinic staff nurse, and she brought to the child to me. And this is the nature of the child hair when I see him the first. Almost complete hair, but here some patches are there. But what the mother said that patches are started, that's then it will become a slowly hair loss in this whole area. And family history, mother also has allergic rhinitis. Elder brother also has recurrent upper respiratory tract infection from childhood. And all physical journals are almost normal, except he has some desire to squeeze cold water. And one thing is that aversion to milk and sweat more, especially on the neck and head. And he has a tendency to be constipated on the least change of food, even in the change of weather or medicine, anything. And other urine, stool, sleep, everything is normal. And mental general, he used to sit quietly on his mother's lap and seems to be very attached with her. He is very playful in nature. He answered all questions with a smile on his face and is very cooperative. Like to play with toys, very adjustable when parents went to their work, happy to go to nursery. On physical examination, what I felt, he looks very pale, lean and thin, hypertrophy hypertrophy turbinates in the nose that indicate that he is allergic only. Chest was normal and there is hypertrophy tonsils, but he doesn't have any recurrent attack of tonsillitis. And special investigation report the brought from the mother, what I saw that hemoglobin was 10.7, ESR was normal, and there is not much change in the WBC count, but eosinophil is little high with the 6%. And TSH was also normal, but the mother complained that he had a history of vitamin D deficiency and took syrup for 6 months also. See, this is a situation. I got the case. The first aim was we have to stop the prednisolone. Then only we can start a homeopathic medicine properly to treat the case. First, what I did, as his respiratory symptoms were stable, and still he was on prednisolone alternate days, and occasional sneezing in the morning. So I gave Naxomica 200 for 3 days and advised the parents to stop prednisolone. After 3 days, I told them to give Calcarea Carb 30 with the Natramor 6x. Exactly after 5 days, the mother brought the child with a cough, which is aggravated in the night because we stopped the prednisolone. Sneezing and coryza started 1 day before the cough with a thin watery discharge, because they are afraid that normally every time after the cold and cough, the child will lead to wheezing respiration. But that when the 5th day, when I observed him, his chest was clear and there is no respiration, wheezing respiration. So I started arsenic album 30 for 5 to 7 days, but Natramur was I'm continuing. And after 1 week, again, they brought a child with a better in cough, but the nasal block at night and thick productive nasal discharge day and night with a disturbed sleep. Actually, these are his symptoms are coming up slowly. We started Kali bike TDS with the Natramur. And after 1 month, almost exactly after 2 weeks, they came with a better in cough and nasal congestion. Mother was happy that It was the first time they could manage the situation without an antibiotic. Boy looked very energetic, but there is no much improvement in the growth of the hair. So what I did, calcarea carb, increase the calcarea carb 30 to 200 weekly, 1 dose for 4 weeks. Natramo 6s, still I continue. See, on the May, after February, March, April and May, I couldn't see, March and April, I couldn't see him, because you know that because of the lockdown and all, it is very difficult to see the children. We are do only to the teleconsultation. The May, this was a situation, slowly, hair seems to grow slowly. The child is stable with a dry cough on April, managed with the Belladonna 30 on teleconsultation. Couldn't advise to consult due to lockdown. Calcarea carb 200, 1 dose fortnightly. In between, I gave a dose of Tuja as an intercurrent remedy. And after exhaling, after 1 month, hair start to grow, but seems to be very thin. But luckily, no attack of cough or any rhinitis in between. So instead of Natramore 36x, I increased to Natramore 30 with the placebo for 1 month. Then 1 month after, it is very stable, hair gets strong and black, no history of any allergic symptoms since March. Increase to calcarea carb 1 dose. Advise the patient to arrange Vispadin, because which is not available in here or not legalized here. Always will depend on patients to bring the medicine from India. They brought a Vispadin 200 from India. See, in June, this is a situation, and July, I took the picture. Yeah, from August onwards, we started Vispadin 200, and in September, they brought, he's absolutely healthy with any recurrent attack of rhinitis or asthmatic attack once he started homeopathy, except 1 or 2 attack of simple cough and cold. This is the last picture I got in September. This is our case sheet. Normally, this is the way we are making the case sheet, the online prescription we are doing. See, in this situation, what we have to analyze that alopecia areata is a situation, we know that what is the exact reason, but once we start the medicine, we have to improve the general status of a child or general status of a patient. Then only the proper growth of the hair or the proper, we can say a proper cure happen. Along with the hair growth, a general improvement of the person also should be happen, because we don't know the exact reason of alopecia. And also it's a commonly say that there is no need of treatment for alopecia areata, because normally a patchy loss will happen after 1 month or 2 months. The hair may grow naturally also. If the natural growth is not happening more than 3 months, then only the medicine is needed. But in this situation, his hair is getting worse every month. Every month, slowly it is falling, and the situation is almost coming into the stage of alopecia totalis. Okay, then I have the next case 2. A 30-year-old lady, she's a dentist by profession, visited on December 2019, complaining a sudden loss of hair in 3 different areas in scalp, which is noticed, but she said that it's noticed 3 weeks before only, but she said a thick history of dandruff on the scalp without any irritation or itching. And this is the situation when she came to me in the beginning, but in the 3 areas hair. But even I was also surprised why she is not noticed this much loss of hair happen. The reason is that she has a tough hair. That means a thick hair history is there. So she said, I am not aware of this much hair is loosened from my hair. And only the past history, what I noticed, that dry skin from childhood, and generalized hair fall since 1 year, because she was anemic since pregnancy. In physical general, almost everything is normal. Stool is constipated and very upset on it, as she did many treatment on constipation. Menses is regular, but moody before period, low spirited before menses. And mental generals, she looked very much worried and depressed while describing her symptoms. She is very attached to her child and breastfeeding, though the child is 2.5 years old. Everyone in family advised to stop the breastfeeding, but she is very much reluctant to stop it. That is what her husband told me, that she is very adamant to give feeding even though she is looking very weak and pale. Husband said that she was very active and restless but became dull and emotional due to her present health issues, or maybe because of her tight work schedule in clinic, and depressive mood before the period in every month. On physical examination, she looks pale and lethargic, dandruff on scalp, which is dry and white. Hair looks very dry and with chapped lips. Maybe this indicating that maybe she is anemic, or maybe some because they said that there is a constipation history is there. I advise to check CBC, TSH, and vitamin D. But in the first visit, on looking only on the scalp, dandruff and all, hair fall, constipation, dull, pale, lethargic, I prescribe Tuja 30 for 3 days, followed by Natrimo 66 for 15 days. Advice to add vegetable, fruits and dates in her diet. And also strictly, I advise to stop the feeding, because breastfeeding may be the reason, because since 2.5 years she's feeding, that will make a lot of changes in her metabolic, even in the nutritional part of her body. So advise her to stop the feeding and add vegetables and fruits in their diet. On 1st January, she come with much improvement in the general status. And even she said that dandruff is reduced, but no areas of hair falling, but there is no change, growth. I didn't notice, but so I repeat the same medicine. And after 1 month, she came with the hair start to grow slowly. Dandruff was under control, scalp looked clean. Emotionally looked very dull, though she didn't complain anything. Blood report was come to be normal, except hemoglobin was 11.5 and TSH is not there. Vitamin D is also sufficient. And hemoglobin come to 11.1. And I increased to Natromor 30, followed by weekly 1 dose of Tuja 200. And exactly after 1 month, hair start to grow. And one thing she observed, that there is no more PMS, because before that she said that I am very much dull, lethargic, irritable during my period, before my period. But I felt that I am little relaxed. That is what she said, and she looked very happy and relaxed. And same, once again, I repeat for 7 days with the Tuja 200 as a fortnightly intercurrent. This is in February, exactly after 1 month when she come. This was the nature, but it was not that much strong. In March, I couldn't see her during the lockdown. She complained about her dry skin when she started to use AC in the summer start, because in March, April, we start the AC, or that is her normal nature also, the dry skin. Advised to 1 bottle of Natrum, because that time, during the lockdown time, the clinic was also closed. I advise her to buy 1 bottle of Natromor 200 from the pharmacy and took a dose, weekly 1 dose, followed with Kalium Muriaticum 6x. And after 1 month, good improvement in the growth of the hair, better in the constipation and dryness of the skin. One thing noticed very much is the change in her emotional status. He looked very happy and relaxed. No PMS in the previous month also. One more time, Natromor 200, 1 dose every 15 days are advised to take, and Kalimur once again to repeat for 30 days. This is in the nature in the situation in April. This is March and this is April. Almost hair is coming up in April. This is our consultation details. See, she didn't visit the clinic after April, because she said then this working every day. Most of the time, our clinical time is always matching each other. It is very difficult for her to visit every month. And so she gave a call to me, inform her that her hair growth was complete in all areas. But after 2-3 months, I think on July, she come to the clinic to show her daughter, and I took this picture. I don't know which area now. Almost hair is grown, and we advised to stop the medicine and add only fruits and vegetable in her diet. That means with the 3-4 months of treatment, we can completely make the clear. And along with that, there is a general improvement in her mental status and as well as her PMS, even in her dry skin. Okay. This is a small case. It's a alopecia areata monolocularis. Actually, this is on my old patient. He is always complaining. He is coming to my clinic in between recurrent, so many normal acute infections for any seasonal changes. He will get tonsillitis or any normal upper respiratory tract infection. So I know him before itself. Actually, he was an accountant by profession. Visited on 21st Jan 2020 with a history of localized falling of hair on a single spot. But he said that he noticed in 3-4 months before while getting a haircut, but he did some remedies, home remedies, but the area of the spot increases gradually and was noticed when he had his next haircut. But he said that I was just neglected that small area, doctor, when I went to my haircut. But the next visit also, the salon, the people say that the area is getting more. So he visited on January. For him, I don't need to much do any case taking, because I know that almost his symptoms are with my hand, and he don't have any other history of any illness, and only that particular, he always has a history of any past illness, no, and everything was everything normal. He is a chilly patient, desires sweets, and general aggravation always from cold. That is why you always come for tonsillitis or any other normal acute respiratory infection. Looking very short, very apprehensive nature. And I gave calcaria carb 200 weekly 1 dose. And on case taking, what he said that I was not so comfortable in the office since 2-3 months, because recently there is some work pressure in the office, but I could able to manage it, doctor. That was his sentence. Okay, I could able, but that I know that is disturbing me a lot. That was his comment on the reason I asked him what make you to make this situation. So I simply give calcaria cup 200, take 4 pills 1 time every week. I gave 3 doses along with Califo 6x. I used to tell him for 20 days. The next, but he came on February. There is hair is almost start to grow, because I can see that the follicles are stimulating there, because the area will become rough instead of the plain area. The follicles are about to start. So again, I repeat, I tell him to take calcaria carb only, and I give only a 1 dose Tuja 200. This is our prescription online nature. Then I couldn't see him during this March, April because of the situation. And in May, he sent a picture like this, asking me whether we need a treatment or not. See, this was on the 3 visit only he gave. The patient did not come after March due to the COVID situation. In the month of May, he sent a picture and expressed his gratitude. I told him to stop the medicine, but he is continuing the Califos for one more, advice to continue for 1 more month. Okay, this is a 3 case I wish to present. And what I felt from managing the alopecia areata, constitutional treatment is very important, because alopecia, in managing alopecia, along with that managing the alopecia, we have to clear the reason, or we have to clear their general improvement, or we can improve their general health also. Okay. And general management, alopecia areata can be emotionally challenging, especially when hair loss affects the whole scalp. People with the condition may feel isolated or become depressed. Explanation and assurance is very much important. Find out the cause and correct it properly. In some cases, especially in the male pattern baldness with a genetic history, or genetic tendency, the patient should be explained and encouraged to accept the hair loss. That is very important, because people will come and ask us whether we can treat it, if it is my hair is coming up, if I started my treatment, whether I will get the hair back or not. In the situation, we have to explain the patient. So we should have the enough knowledge to find out what type of hair loss is happened. Okay, if it is a male pattern baldness, we should explain him properly, or we should give that enough encouragement to accept the fact. The patient is encouraged to clean the hair regularly. A balanced diet, one with whole grain fruits, vegetables, and meat, and proper sleep, exercise, and an active lifestyle should be needed for a healthy hair growth. Along with the medicine, these are the points we should be keeping in our mind. And coming to the homeopathic management, as I told already, majority of the cases where the patches do not increasing in size or number do not require any treatment. But in case where the size or number is increasing, or if the hair have not regrown in any patches even after 3 months, that is important, treatment must be started immediately. In that, miasmatic diagnosis is important. Homeopathy is based on nature's law of cure and treatment done on the basis of individualization of the patient and holistic approach of cure. The psychosomatic disorders are one of the most common causes of hair loss, especially in the alopecia areata. Homeopathy, with its holistic approach, considers the patient as a whole and so plays a very good role in treating psychosomatic disorder and thereby curing alopecia. Proper miasmatic diagnosis of each case can uproot the underlying cause. Miasmatic prescription is therefore both curative and preventive. In my clinical experience, what I am using the miasmatic or constitutional medicines are Calcarea car, Graphitis, Lycopodium, Nitromor, Phosphorus, Sepia, Naxomica, Medorinum, Thuja, Tuberculinum, and Sulfur. Along with that, Sorinum, Syphilinum, and Fluoric acid give wonderful result when our constitutional medicine fails to give a result. Along with that, Fluoric acid, I especially want to mention, some situation, we are advising miasmatic or constitutional remedy, we advise sometimes intercurrent, we are giving Thuja or Tuberculinum or Syphilinum, but some rare condition, we should not get a result, because that progress will not be stuck in somewhere. Fluoric acid will give a wonderful result, irrespective of looking on the symptoms or any background. We can advise fluoric acid 200 potency, 1 dose, even 1 potency also. That will give a good beginning of our cure, starting of the growth. And effect of shoeless tissue remedy, as we saw that here we couldn't give a placebo, or we are restricted with some of the acute specific remedies. Normally we are advising along with our constitutional remedy. So here mostly I am depending upon the shoeless tissue remedy. We are all familiar with our 12 tissue remedy. Along with our well selected constitutional specific remedy, I added one of the 12 tissue remedies, which is well indicated after a detailed case taking, at least in the beginning months. I found it stimulates the healing process and regenerate or stabilize the body. Some of my favorite tissue salts are Ferrumphos 6x or 12x, but here we are using 12x only because we are not getting 6x. The people with the anemic, pale, and hair fall after an acute illness. Like Nitromor 6x, anemic, cachetic, sensitive person, and also nursing woman. And Sreelekha 12x, person with the imperfect assimilation and defective nutrition. I usually use along with the Thuja, Pulsarilla, or even with the fluoric acid, as it complement each other. Sreelekha is a very complementary to Pulsarilla. Califo 6s, if I suspect a mental or physical factor or any depression which is leading to a long continued grief or overwork, Califo 6s is also added along with our well indicated constitutional remedy. and Kali sulfuricum. Kali sulfuricum mostly 6s we can advise with the patient with a history of dandruff or any history of seborrheic captitis or with a history of dry skin, if a parapsoriatic nature, not a psoriasis but parapsoriatic nature or something. Kali sulfuric is a very important remedy. Then after that, when we feel that Kali sulf has acting a good result, even sometime when our well indicated remedy is not giving a result, especially our constitutional remedy is not working, Kali sulf I will increase to 30 to 100. That itself will sometimes giving good result. Same like Sreelekha 12x, we can after early 1 or 2 months after, we can jump to Sreelekha 200. Along with the Pulsarly, if Pulsarly is our constitutional remedy, we can go ahead with like that also. Even Natremor also, we can go ahead with 6x to 30 to 100 or 1 potency if we are getting a good result. And some of the clinical tips on hair falling. Hair falling after pregnancy and delivery, Natremor and Sepia. And with a dry, scaly dandruff, normally I started with the Tuja along with the well constitutional remedy. And usually prescribe Visvarin 200 for healthy growth once the hair start to grow. And Phosphorus 200 followed by Calcarea Phos usually gives a good result for hair, falling of hair in bunches, especially in youngsters when the constitution matches. And sometimes Calcarea Phos along with the Phosphorus 200 with the Calcarea Phos 6x, or usually I will start sometime and then to jump to Calcarea Phos 200. And Graphitis 30 for herpetic dandruff with the hair falling. And borax is also very effective when the hair is rough and tough and it is very hard, couldn't comb properly. Hair tangled at tips cannot be separated as in Plica polonica. We all read in boric. And alopecia due to debility, mainly acid force. Nowadays, because of the COVID pandemic situation, diffuse alopecia is also a common situation coming to the clinic after the COVID attack. Acid force is very important. Acid force is especially after the viral asthenia, people with debility after the viral attack. Acid force is very important. Acid force 200 we can use clinically. Alopecia due to grief or depression, Natremor, acid force, even ignitia also we can give. Some of the homeopathic medicine, Calcarea carb, itching of scalp, sensation of coldness on outer head, profound sweat, especially on the head, great sensitiveness of the head with the yellowish or whitish scales on the scalp, hair falls, especially on combing. I only noted down the points mainly for on the hair or head only. Other symptoms, general symptoms, you should match up before prescribing the medicine. And Natremor, we know everything. And constitution, I didn't write, I didn't say anything because all we know that the mental status of a nature and desires and aversions. Hair falls out if touched, mostly on forehead, temples and beard. Scalp very sensitive. And also the nature of the face, as you know, it should always shining as if greasy. Falling of hair during pregnancy and in chronic headache, that is important, Natrum muriaticum. And Thuja occidentalis, white scaly dandruff and hair dry and falling out. Thuja, I always use as an intercurrent remedy also in between. 1 dose of Thuja always help to improve the situation. Or it will speed the cure. And acid floricum, itching of scalp with the falling of hair, the new hair is dry and break off. The hair will grow, but it will break and it will become again, that area will become devoid of the hair. In this situation, they split and break, and falling of hair due to syphilis. Some syphilitic constitution also will match with the acid floor, as you know. But in some situation, without having any symptoms, acid floor is blindly we can use. And Mancinella, losing of hair after severe acute disease. It is very good remedy. And phosphorus. Phosphorus is one of the best remedy for alopecia areata, especially in youngsters, hair fall after mental emotion or sickness, round patch on scalp completely deprived of hair, falling of hair in the large bunches of tough occiput, forehead, or on side above the ear. The root hair seems to be dry, dandruff copious, fallout in clouds, itching of the scalp, dandruff fallout in clouds, itching of the scalp. The denuded scalp looks clean, clear, white, and smooth. The scalp is looking very clear. We should not find out not even a hair follicle in that area. But definitely after starting the phosphorus, you can see that the roughness will come up slowly if the medicine is very well indicated. But in phosphorus, sometime after giving, if we feel that it is the patient is phosphorus, but still we are not getting a proper treatment. In 1 or 2 cases of experience, I started calcarea for 6x. That is only after some time only I came to know that that goodness of you starting the calcarea for 6x along with phosphorus, and slowly then after that we can increase the dose to calcarea force 200 also. And selenium hair falls off when combing, also of hair, eyebrows, whiskers, vertex, eyelashes, and genital, tingling, itching on scalp, does not want hair touch, that is selenium. And Calicarb constitution, as we all know, Cali group, and if the symptoms is matching, Calicarb we can use, and especially alopecia after nervous fever, dry brittle hair rapidly falling off from beard, temples, eyebrows, and mustache, dandruff, and graying hair. Calicarb is very indicated, especially for ladies. Lycopodium. Hair falls from temples and vertex. Hair become gray early. Hair fall off after abdominal disease. When abdominal symptoms are predominant, lycopodium we can think. After purchasation with the burning, scalding, itching of the scalp, and even dandruff. For dandruff also, lycopodium is very good remedy. And arnica, improve the blood circulation to the hair root. It enriches the scalp with the nutrient which help to cure and control dandruff. Vinca minor. Vinca minor is one of the best remedy we can give. It's a short-acting remedy, but we can use along with something along with our well-selected remedies. There, the itching of scalp is very important, and sometimes some hair looks very what we call oily or moisture, with the hair always will group together, matted together. That in condition vinca minor is very important. Hair falls out in single spot and white hair grow there. Spots on hair oozing moisture, the hair matted together. It is important. And the dirty looking hair in vinca minor, and bald patches covered, itching of the scalp. Acid force, I already saw. It is mainly used in situation where people are suffering with the debility after a disease, or even in the emotional or mental distress. Anything which will make emotional distress or anything that patient is looking lethargic or weak physically and mentally, acid force is very indicated, and falling from hair from beard, eyebrows, and genitals due to grief. I usually start with acid force 200. Sepia, falling of hair during menopause and pregnancy, losing of hair due to head, aversion to opposite sex is well marked, along with the other constitutional symptoms. Yeah, this is the end of my session. Deepu? Dr. Deepu?
Yeah, I'm here. Dr. Sreelekha, we can look for the...
Dear participants, please post any questions if you have, or feel free to ask.
Can I stop sharing?
Yeah. Yes. Yeah.
Any doubts?
Yeah, the screen sharing is actually not...
Doctor, there's a question asked about repetition of Wiesbaden.
Wiesbaden. Yeah, Wiesbaden 200, I will give it to tedious for 1 month. Then if it improvement, I tell him to give a dose of daily 1 dose for next 2-3 months.
Doctor, about scalp psoriasis.
Scalp psoriasis normally started with a detailed case taking, and we will take constitutional medicine only, but along with that acute remedy, because here we are mainly, as I told you, we are unable to give any other get any other specific remedy. We will always start with the constitutional remedy with the low potency. I am always started with the low potency, but for me better result I will get from arsenicum, iodatum, kali sulf. And even along with our constitutional remedy, I will use that well.
Doctor, about alopecia associated with ovarian cyst.
Ovarian cyst. In that situation, normally, all constitution, always think about the constitution, natremor, sepia, even lachesis, graphitis, everything. Calcarea curve is very important when we start with the, along with that biochemical remedy, I am using that calcarea floor I will use, because a continuous because alopecia areata or even situation we should have here we should give something as a daily dose also. We cannot advise 201 dose and tell the patient to come back after 1 month. So along with that, always we advise one biochemical remedies. For that one, calcarea floor I give natremor 6x. Even sepia is indicating, I will give natremor. If pulsarilla is indicating, definitely I give Sreelekha 12x. Here Sreelekha 12x is available. 12x is I give a daily dose of 1 tablet TDS.
Yes. There's a question from YouTube. How to decide dose of tissue remedies?
Tissue remedy. TDS 3 times. 6x is there, 3 times will give. 4 tablets 3 times. And even it is 12x is there 2 times daily.
And then when to give intercurrent medicines?
Intercurrent medicine normally we'll do, first we'll start with the constitutional remedy. And first visit, if you are not, after first visit, if you are not feeling comfortable, and also we there is a multiple miasma, we start with an anti-miasmatic remedy or a miasmatic remedy as a constitution. Even after 1 or 2 visits, we are not feeling comfortable or we are not getting a proper result, as we are not feeling that the hair follicles are not stimulating. Normally, I get a good result from Tuja, or even Tuja I'll give, Syphilinum I give as an intercurrent remedy, even tuberculinum also.
Arnica and Jaborandi as external applications.
Here we cannot advise like that, but normally I advise the patient to buy from, bring from India, because external application always, if they do properly, see, using the external application, I'm not believing that much, but people have a satisfaction if I advise, okay, do hair, because here the main reason that doing the external application, we are massaging the scalp properly. That is, we advise the patient how to massage the hair scalp properly. And because with our fingertip, you take the hair, no, simply putting the hair on the oil on the hair is not a method. Tell the patient to take the oil and with our fingertip itself massage properly with a genuine massaging. We have to stimulate the blood vessels. That is actually that is the basic reason why we are advising the massage oil. Okay. After that, they can do a hot oil bath also. Tell them to do some hot compression, that steam on the hair. That also stimulate the hair follicle to grow. Otherwise, I am not that much believe in putting oil. But if asking, I will advise they can arrange arnica or jabarandi oil. No.
Okay. Dr. Leela Patel had asked, 3.5-year baby with hair fall and single patch of baldness, how to approach?
What will be the other symptoms, sir?
Yes. Dr. Jagrati, I think you should, Dr. Leena, you should specify that. There is another question. Alopecia totalis in 1.5-year-old girl. Constitution looks like calcarea. Not much change. How to go ahead? Any suggestions? Dr. Avinash.
Calcarea curve, no?
Yeah.
Yeah. If a child with a alopecia, what she said, totalis, no?
Totalis.
Alopecia totalis and alopecia universalis, the problem is that there are some cases, sometimes when you give the medicine, it will respond. But after when you stop the medicine, after some time the hair will lose. That is a situation, 1 or 2 cases I felt. Here we have to find out what is the reason behind. We can do for a hormonal analysis, whether any thyroid issues or any other reason in chromosomal or any genetic history is there. We have to find out what is the exact reason which make the child to come into that situation. And also calcated curve indicate also you can try with the high potency. Along with that, we can give a intercurrent remedy. Along with even biochemical remedy also we can use. But what I advise is that we have to find out any reason behind that, especially for children.
Okay. There is another doubt. Hair fall in Hashimoto's thyroiditis.
In that situation, it is very easy to manage because the situation now the diagnosis is with our hand. Even we'll just see what is the even hormone levels are normal or whether how is the situation. The diagnosis is become okay. Though we are not saying that we are not fully depending upon diagnosis. Definitely for treatment case or advising the patient, we should know at least what is making the situation. Okay, that in this situation. Along with the constitutional remedy, we should go ahead with some of the medicine which have action on the thyroid. Along with we can add iodine or even calcareous flour, even any medicine which will stimulate the thyroid gland can also used. Even calcareous carb also in slow dose we can. Calcareous iodata is also important. Depending upon the case, we can add the medicine which will stimulate the thyroid gland also.
Any other nutrition or vitamin supplement advice?
Yeah, suppose vitamin. Suppose when we are checking what is the reason, anemia is there. Definitely, some small children and all parents will ask whether we'll give iron or any multivitamin. Or normally, I will not advise directly to take like that. But advise them to concentrate on diet, especially fruits, vegetables. In the fruits, normally I advise to take anar, pomegranate, avocado, and papaya. The children are very reluctant, but still even adult also. But advice to take that more, or any vitamin, any fruits which containing more iron, even zinc and all. And vitamin D deficiencies are very common, especially in here we advise to go for an outdoor. Otherwise, in very rare condition, we are getting the cases with the doctors. Those already advised iron or vitamin D. I never advise a patient to stop everything and take our medicine like that. If they are continuing their treatment of vitamin D, I never tell them to stop. Also, they can go ahead with that. But anyway, it will vitamin supplement will directly or indirectly it will help definitely. But I always suggest go ahead with the diet chart only.
Okay. Dr. Sripriya, are you there? Hello.
Ma'am, one more question. How many, for how long should we continue the biochemics?
That is, I already mentioned in the early 1 or 2 months, definitely the our medicine biochemic will help. Especially now the first case itself, I said Natramor 6X, I will start with Tuja. Because in that situation, in the first, normally some condition, first visit or second visit, we cannot analyze the full patient, the full nature of a patient, or sometimes we are also, we will not get a correct picture of the patient, whether which constitution or we are something. In that situation, the biochemical remedy, which one is more applicable, I give. First 1 or 2 months, with 1 or 2 visit will come to know exact which constitution remedy is that patient. When I start that one, normally I will stop the biochemic. So very rarely, when Natramor 6 we start, automatically Natramor only I have felt she or he is that. I will jump to Natramor 200 or 1 like that. Till I am getting that one, definitely I will continue the biochemical remedy, especially for alopecia areata cases. And once I find, definitely I will skip. Especially in giving the higher potency, when I coming to the 1 or 10 potencies, definitely I stop the biochemic and I give placebo only. And that condition, sometime I advise to take Visbad. These are all depending upon the case to case, because some conditions we are very blind what we have to give, because it is very difficult to elicit the case, because patient will complain only the symptom. Whatever question we ask, they said that we don't get any symptoms behind the alopecia areata. But slowly after 1 or 2 visit only, we will come across some of the physical journals or mental journals which help us to lead a constitutional remedy.
I think there is any experience in scarring alopecia?
No. Scarring alopecia, so once we feel okay, after first visit or sometime we will not get an idea whether it is exactly scarring, but sometime the people will say that it will come after the result of a burn. We can say frankly that, because what is exactly the physiology behind that, or pathophysiology behind to make him that hair loss. Otherwise, sometime after 1 or 2 visit also, we are not happy, we can convince and tell them that we are not getting any good result.
Okay.
My personal opinion, because I didn't get any case like that.
Okay. Any specific medicine for patchy alopecia? I think.
No, I cannot say that a specific remedy, and especially here, I told we are not using any specific remedy like that. But still, commonly say that natrumor, calcaricar, commonly we can say. Even phosphorus is very indicated.
Any more doubts, Dr. Sreelekha?
Hello. Ma'am, I think the questions are over now. Any more doubts or queries? I think the doubts are over.
Dr. Meenakshi, you can unmute, okay.
Okay.
Dr. Meenakshi, you can unmute yourself if you wanted to ask anything.
Okay. A very good afternoon, ma'am.
Yeah, good afternoon.
Ma'am, a child who is having a habit of pulling out his hairs, and due to this, he is getting bald spots. So, which medicine works in that case?
Okay. Your patient or your child?
No, ma'am. He was my patient. Right now, due to Corona, he is not attending the clinic.
Okay. And see, the pulling of hair, we call it trichomania. That is a condition the child, because it may be because of the fear, it may be because of the insecurity or any emotional disturbance, which make the child to keep on pulling the area in a particular area, especially in the ear or in the front of the head. In that situation, ask the parents what exactly the reason which make him to be behaving like that, or ask the elicit the case properly, which situation make the child to start this behavior. Okay, because only for a trichomania we cannot give any medicine proper. Simply we cannot advise, because the reason why the reason is he is keep on mechanical pulling is there. We have to stop that. Why he is doing, we have to find out. Then depending upon that, we can go ahead with our normal constitutional medicine, calcarea carb, even calcarea force. Calcarea force is very important, and even phosphorus. First of all, find out the child is what type: Sreelekha, Commonly, commonly I am saying that calcarea car, calcarea phos, silesia, phosphorus, these are the common medicine. Emotional disturbance is making the child to be like that. Even nature more.
Okay, thank you, ma'am.
There is a doubt from YouTube. Role of vitamin E as an external application or olive oil, like that.
Frankly speaking, I never recommended any external application during my treatment. But sometimes the people will ask whether we are doing like this before also, can I continue like that? Then I said yes. Before also I explained why it is like that, because any external application, the way how we are using is important, because it will stimulate the hair follicle if you do it properly. If it is a strong massage or something, it will again make a negative impact, because hair follicle will be destroyed. But that when you do massaging should be properly. But some systemic absorption can happen in the vitamin E, because as we say that a mild absorption can happen. But I always believe in giving the medicine internally.
Okay, thank you, ma'am. And thank you all participants for the patient hearing. Now, I think it's time to wind up. And I invite Dr. Maria to please deliver the vote of thanks.
Thank you, Dr. Sripriya. I'm Dr. Maria, here to propose the vote of thanks. Dr. Sreelekha, ma'am, it was a very wonderful session, and you explained very well about the alopecia, its pathology, and you explained the therapeutics well in advance, and also the general management. And I think the whole topic was covered very well, and you explained the cases also in a very easy manner, so that every practitioner can accompany this knowledge into their daily practice. Thank you, ma'am, for taking your wonderful time and giving us this knowledge and imparting us this knowledge. Thank you, ma'am, once again for being a part of this Illumined webinar series. And thank you all the participants for being a part of this. Thank you everyone for being here. And we welcome everyone for the next session also on the next Sunday. Thank you, everyone. Thank you, ma'am, and thank you, everyone.
Thank you. I also express my sincere thanks to Dr. Deepu for inviting me to be a part of this program. And also, I hope I could do justice to my subject. Thank you, everyone, and every one of the doctor for